Okay, so welcome to this next video in which we are discussing the use of glucocorticoids in the treatment of asthma. Okay, so we're just still having a look at the pathology of asthma at the moment so that we can understand how glucocorticoids, both inhaled glucocorticoids and also oral glucocorticoids, are going to work to treat asthma. Okay, so we've just seen that we have produced immunoglobulin E molecules against this allergen. Now, once the immunoglobulin E has mounted on this Fc epsilon R1 receptor on the surface of mast cells, its half-life is around, well, is months basically. Its half-life takes months for the number of IgE molecules that are on the surface of mast cells in Fc epsilon R1 receptors to half is going to take months basically. So, this will last for a very, very long time, whereas IgE levels in the blood will go down very, very quickly, basically, as the plasma cells also become removed and therefore stop producing any more IgE. Okay, so plasma levels of IgE will go down as the plasma cells that produce it also go down. However, the IgE that's bound to Fc epsilon R1 receptors on the surface of mast cells, this has a much longer half-life. The half-life of this is months, basically, so it will remain on the surface of the mast cells for much longer than the IgE that is within the blood will remain within the blood. Okay, so if you then get exposed to the allergen again, whilst IgE is still mounted on the surface of these mast cells in the lamina propria, what's going to happen is it's going to cause a asthmatic attack, an allergic asthmatic attack. So, let's now say you have your secondary exposure to the allergen. Okay, so we have our second exposure to allergen, and I'm going to actually change that to secondary exposure rather than second exposure, because it might not actually be your second exposure, it could be your third exposure or your fourth exposure. Okay, it's going to trigger the same thing. As long as the IgE is on the surface of the mast cells, it's going to trigger an asthmatic attack. Okay, so the allergen then is inhaled into the airways, okay? And now some of this allergen will end up in the lamina propria of the bronchi, okay? So some will get past the epithelial cells and end up in the lamina propria. And this allergen that gets past the epithelial cells into the lamina propria is going to bind to these IgE molecules that are on the surface of the mast cells in the lamina propria, which is bound to the Fc epsilon R1 receptors on the surface of these mast cells. So, in comes our allergen here, and now it's going to bind to this IgE that is targeted specifically against this allergen. Okay, so this activates the IgE, which then activates the Fc epsilon R1 receptor, and that now is going to activate these mast cells. Okay, so what does the mast cell do when it's been activated? Well, let's just bring this down here a bit. Right, so let's draw the inside of the mast cell in a little bit more detail. So here is the nucleus of the mast cell, and now mast cells are full of little vesicles, basically. So these are little vesicles here, and these vesicles are full of histamine. Okay, so let me fill these vesicles up with histamine molecules. So we'll show histamine as a turquoise dot. Okay, so these are histamine molecules within these vesicles. So these vesicles, which are full of histamine, they are histamine granules. Okay. Okay, so the special name for vesicles like this in mast cells, which are full of histamine, is to call them the histamine granules. Okay, so one of the things that is going to happen when the mast cell becomes activated by its Fc epsilon R1 is that it's going to cause the degranulation of the mast cells. So the mast cells are going to release these histamine granules from their cytoplasm into the extracellular fluid, and therefore you're going to release histamine. Okay, but histamine is not the only pro-inflammatory mediator. It's not the only alarm signal that these mast cells are going to send. Okay, so let's discuss this in a bit more detail. So, when the Fc epsilon R1 receptor becomes activated, it leads to an increase in the calcium level within the cytoplasm. So calcium within the cytoplasm goes up. This calcium then is what causes the exocytosis of these histamine-containing vesicles. Okay, so it's what drives the fusion of the histamine granules with the cell membrane, and therefore the release of the histamine contents into the extracellular space. Okay. Also, however, calcium being high within the cytoplasm is going to activate a certain enzyme. Okay, so there is an enzyme within the cytoplasm known as cellular phospholipase A2. Okay, cellular phospholipase A2, and this enzyme is usually within the cytoplasm of the cell. Okay, so it's not usually at the cell membrane, instead it's deep within the cytoplasm. Now, what happens is when calcium goes up in the cytoplasm, it's going to bind to a special domain on this cellular phospholipase A2. And by the way, the symbols people often use to denote cellular phospholipase A2 is as follows: C for cellular, PL for phospholipase, and then A2 for A2. Okay, so the cellular phospholipase A2 has a special domain which is known as a C2 domain, which is a conserved domain that you can have in all sorts of different proteins, which is capable of binding to calcium. So when calcium goes up, calcium is going to bind to this C2 domain, and what this triggers is it triggers the enzyme, which was deep within the cytoplasm of the cell, to translocate. Okay, so it will migrate from the cytoplasm up to the inner leaflet of the phospholipid bilayer. Okay, so it's going to go up and it's going to sit at the inner leaflet of the phospholipid bilayer, just below the phospholipid bilayer. And now what is it going to do? Well, it's going to work on a substrate that is within the phospholipid bilayer. Okay, so it's going to break down a substrate known as phosphatidylcholine. Okay, so phosphatidylcholine, which is often abbreviated to PC for short. So PC is short for phosphatidylcholine. Okay, now phosphatidylcholine basic molecules are basically just modified phospholipids. So let me show you the structure of one of these. So we'll start off with the normal structure of a phospholipid, and then we'll modify it to make it a phosphatidylcholine molecule. So here, what I've drawn so far is the structure of a normal phospholipid. Okay, so let me highlight the different portions here. So this horizontal line, which I'm now highlighting in green here, this is the glycerol molecule. Okay, so this is glycerol. Okay, and the proper chemist name for glycerol is to call it propane 1,2,3-triol. And although propane 1,2,3-triol is a bit of a mouthful, it's a good name in that it tells you exactly what we are dealing with here. It tells you that we have a free carbon hydrocarbon, okay, where you have alcohol groups coming off the first, the second, and the third carbon, one alcohol group off each. So it's a free carbon molecule where each of the carbons has a single alcohol group coming off it. Now, to the first and second alcohol groups of the glycerol molecule, you are going to esterify long-chain carboxylic acids, okay, which are shown here by these orange vertical lines, okay, so these are long-chain carboxylic acids, which again is the proper chemist's name for something a biochemist would call a fatty acid. So long-chain carboxylic acids, or if you're a biochemist, you can call them fatty acids. Okay, right. So these are just carboxylic acid molecules which have extremely long tails. Okay, so you take two of these carboxylic acid molecules with extremely long tails, esterify them, to the first and the second alcohol groups of the glycerol molecule, and then that occupies both of these two first alcohol groups and is going to anchor the phospholipid within the phospholipid bilayer, because these are very hydrophobic molecules and interact well with the other hydrophobic molecules within the hydrophobic core of the phospholipid bilayer. Okay, now onto the third alcohol group of the glycerol molecule, you attach a phosphate group via a phosphoester link. Okay, so this is a phosphate group. Okay, and let me colour this in vivid purple. So, the first two alcohol groups have carboxylic acids esterified to their alcohol groups. The third alcohol group has a phosphate group esterified to it, but via what's known as a phosphoester link rather than a ester link. Okay, so this whole structure then now is called a phospholipid, or the old name for a phospholipid is to call it a phosphatidate molecule. So this is a normal old boring old phospholipid, and although you will never ever hear anyone refer to a normal old boring old phospholipid as a phosphatidate molecule, when we're talking about slightly more interesting phospholipids, when we're talking about modified phospholipids from the boring old normal one, you use phosphatidate all the time. So this phosphatidylcholine, phosphatidyl refers to this normal old boring old phospholipid structure. Okay, so all you're going to do is bind a choline molecule onto phosphatidate to create phosphatidylcholine. Okay, so let me just show you the structure of choline. Okay, so choline is an alcohol, and it's the same molecule that you have within acetylcholine. Okay, so here is the alcohol group, then you have a 2-carbon structure here, and then off this carbon over here you then have a nitrogen which has 3 methyl groups attached to it. Okay, and this nitrogen has 1 too many bonds, so it shouldn't have 4 bonds. So instead it ends up with a positive charge because it has 4 bonds. Okay, so in one of these bonds, both electrons have come from the nitrogen. And of course the understanding in a covalent bond is that one electron comes from one species and the other comes from the other. Okay, so for instance in one of these bonds here, one electron would be from the carbon and the other from the other carbon. Okay, whereas here, that if the nitrogen has provided both electrons, then it's as though the carbon has nicked an electron off the nitrogen, because the understanding is one of the electrons belongs to the nitrogen and one belongs to the carbon. Therefore, the nitrogen has effectively lost an electron and has a positive charge. Now you might wonder, well surely that should mean the carbon has a negative charge. Well, it would do, except for the fact that the carbon originally, when it came into this bond, would have had a positive charge. Okay, so gaining an electron hasn't made it negatively charged, it's made it neutral, and effectively it's passed on the positive charge it came in with onto the nitrogen. Okay, so choline as a molecule is positively charged. It has more positively charged structures than negatively charged structures, so therefore overall the net charge is positive. Okay, now you are going to esterify this choline molecule here, then let me just write choline. Okay, you're going to esterify this choline molecule onto this phosphate group here to form a phosphate ester link or a phosphoester link. They both mean the same thing. Okay, and of course the phosphate group has 2 alcohol groups, one that's been esterified via a phosphoester link to the alcohol group on the glycerol, and the other that has been esterified to this alcohol group on the choline. Okay, so here is this choline molecule, which I'm just going to denote as a blue rectangle. Right, so this now is the structure of phosphatidylcholine, and I hope what you can see is that it's just a modified phospholipid. It's just a phospholipid with a bigger head, an extra structure stuck on its head, a bit that sticks into the cytoplasm or the extracellular fluid. So this is the structure of phosphatidylcholine. Now, when the cellular phospholipase A2 migrates up to the inner leaflet of the phospholipid bilayer because calcium has bound to its C2 domain, it's going to act on these phosphatidylcholine molecules which are present within your cell membrane, and I should have emphasized that. These molecules are a normal component of the phospholipid bilayer. You have these in your cell membranes. Okay, so when the cellular phospholipase A2 comes to the inner leaflet of the phospholipid bilayer, it's going to be in contact with these molecules and it's going to start breaking them down. So let me show you the breakdown products of these phosphatidylcholine molecules. Okay, so again, both of the products are going to remain within the phospholipid bilayer. So you are going to cut this phosphatidylcholine molecule into two pieces, you are going to cut off this second long-chain carboxylic acid molecule off the glycerol molecule. Okay, so you're going to hydrolyze one of the ester links. You're going to break the bond between the second long-chain carboxylic acid and the second alcohol group of the glycerol molecule. And what you will create is, firstly, let's draw out the bigger piece that you get, which is the glycerol molecule with one long-chain carboxylic acid still esterified on the first alcohol group of the glycerol molecule, and then with nothing in the position 2, and then with a phosphate group still off position 3, and then the choline molecule still off the phosphate group over here. Okay, and now all I have to do is highlight in that one remaining long-chain carboxylic acid molecule. Okay, so this molecule that you end up with is what is known as lysophosphatidylcholine, and I don't think I'm going to have enough space there. Lysophosphatidyle, and then I'm going to have to go onto this line, choline. Okay, so that dash wasn't intentional, that's just because I've had to go onto two separate lines. So this is a lysophosphatidylcholine. Okay, now the other product is this long-chain carboxylic acid that will again remain within the phospholipid bilayer. Okay, now what long-chain carboxylic acid do you generally have esterified to the second alcohol group of the glycerol backbone of a phosphatidylcholine molecule? Well, this is a very famous long-chain carboxylic acid. You have arachidonic acid here. Okay, so arachidonic acid is the molecule which you have in position 2 generally of the phosphatidylcholine molecules. Okay, so arachidonic acid is not a normal component of the phospholipid bilayer. Usually you do not have it in your phospholipid bilayer. So the fact that this cellular phospholipase A2 has become active means that phosphatidylcholine, which is the normal component of the phospholipid bilayer, is being broken down into these two new molecules, lysophosphatidylcholine and arachidonic acid. Okay, now we're not going to be interested in the lysophosphatidylcholine. We're going to be very interested in what's going to happen to arachidonic acid. Now, arachidonic acid can go down many different pathways. It can be converted into a huge number of different end products. And it will be converted into a huge number of different products in these mast cells. However, we are going to focus on the products that are most important for asthma, and those are the leukotrienes. Okay, so there is an enzyme known as 5-lipoxygenase, okay, which is going to come and act on this arachidonic acid. Now, 5-lipoxygenase, which is often usually abbreviated to 5-LOX for short. Okay, 5-LOX again is usually within the cytoplasm of the cell. Okay, so when calcium goes up within the cytoplasm of this activated mast cell, again this is going to activate 5-lipoxygenase to move from the cytoplasm to the inner leaflet of the phospholipid bilayer, just like it activated cellular phospholipase A2. Okay, and once the 5-lipoxygenase gets to the inner leaflet of the phospholipid bilayer, it's then going to work on the arachidonic acid here. Okay, now it performs two conversions. Okay, so the first conversion the 5-lipoxygenase performs on the arachidonic acid is it converts it into something known as 5-HPETE. Okay, 5-HPETE. Now, what does 5-HPETE stand for? Well, it stands for 5-hydroperoxy. Okay, and then the ETE stands for icosahexaenoic acid. So 5-hydroperoxy and then icosahexaenoic acid. And another name for arachidonic acid is icosahexaenoic acid. There is a slight distinction. Arachidonic acid is a very specific icosahexaenoic acid. Okay, so the double bonds, the 4 double bonds that you have in icosahexaenoic acid have to be in very specific places to be arachidonic acid. But often you'll hear people just refer to arachidonic acid as icosahexaenoic acid, even though it's a little bit more subtle than that, as I've just alluded to. Icosahexaenoic acid is just the name for a 20-carbon carboxylic acid where you have 4 double bonds dotted around the place. It doesn't tell you where the double bonds should be, however. Okay, arachidonic acid has a specific position for those 4 double bonds, but often you will hear people just refer to arachidonic acid as icosahexaenoic acid. Okay, but really you should say arachidonic acid is an example of an icosahexaenoic acid. So, this is 5-hydroperoxy icosahexaenoic acid that we're going to produce, okay, and then 5-lipoxygenase will convert it even further, okay, so that's not the only conversion 5-lipoxygenase is going to catalyze. It's going to firstly convert arachidonic acid into 5-hydroperoxy icosahexaenoic acid, then it's going to convert 5-hydroperoxy icosahexaenoic acid into a molecule known as leukotriene A4. Okay, and leukotriene A4 will then leave the phospholipid bilayer. So arachidonic acid and 5-hydroperoxy icosahexaenoic acid are both in the phospholipid bilayer, but leukotriene A4 will move from the phospholipid bilayer into the cytoplasm. And leukotriene A4 is often abbreviated to LT for leukotriene and then A4. Okay, right. So, leukotriene A4, once it's in the cytoplasm, can go down one of 2 pathways. Okay, so either it can be converted into leukotriene B4, okay, or it can be converted into leukotriene C4. So let me tell you the enzymes which are both in the cytoplasm, which catalyze the conversion of leukotriene A4 into leukotriene B4, and then the enzymes which convert leukotriene A4 into leukotriene C4. So the enzyme which converts leukotriene A4 into leukotriene B4 is known as leukotriene A4 hydrolase. Okay, and it's a cytoplasmic enzyme. Okay, the enzyme which then converts leukotriene A4 into leukotriene C4 is known as glutathione S transferase. Okay, so glutathione S transferase. Okay, and for short, glutathione S transferase is often, whoops, is that going to fit? No, nearly. Glutathione S transferase is often abbreviated as GST, glutathione S transferase. Okay, so we will continue this discussion in the next video because the story is not over yet. Leukotriene C4 can be converted further, and then all of these leukotrienes are going to be secreted from the mast cell, and they're going to form very important pro-inflammatory mediators in asthma.